Okay, I'm going to talk about the bones of the hand. And so first you have to be able to tell me on the exam whether this is the right or the left hand. So you want to look at the way that the joints are able to be moved and see how the curvature of the hand, this would be the posterior, this would be the anterior side of all of these bones, because remember, you're always thinking anatomical position, which means palms facing forward and thumbs lateral, okay? So this would be the right hand. All right, I'm not gonna ask any of these bones disarticulated. So if I ask any bones of the hand, it will be from an articulated hand like this one. So let's first talk about these short bones, which would be at the proximal end of the hand. These are the bones of the carpus. So collectively, we can call all of these bones the carpus, but they are carpal bones. Okay, you need to be able to know how many carpal bones there are, and there are 8. There are 2 rows of 4. The first row of 4, which would be the most proximal, would be the carpals that articulate with the distal end of the ulna and the radius, making up the wrist joint. And then here are the second row of 4 carpals, so 8 total, which would articulate with the metacarpals of the palm. So when you think the carpals, or collectively we can call them the carpus, this is the bones that make up the wrist, okay? These bones right here, okay, these are the metacarpals, or collectively we can call them the metacarpus. The proximal end of the metacarpals articulate with the carpals of the wrist, and the distal end of the metacarpals are going to articulate with the phalanges, the bones of the fingers. Okay. You need to be able to number the metacarpals 1 through 5. Number 1 is always starting with the thumb. So this would be metacarpal 1, 2, 3, 4, 5. Okay, so the metacarpal 1 is of the thumb, okay, that leads of the thumb. The phalanges, the bones of the fingers, for all phalanges except for the thumb, there are 3 phalange bones. We have a proximal phalanx, which would articulate directly with the metacarpals. We have a middle phalanx, and then a distal phalanx, which would be like the tips of your fingers. So proximal phalanx, middle phalanx, and distal phalanx. In the thumb, we lack a middle phalanx. So we just have the proximal and the distal phalanx. Okay. The only carpal bone that I will point out, because it makes up an important joint, is this carpal right here called the trapezium. The trapezium articulates with metacarpal number 1 of the thumb. Okay. And the reason why I want to point out the trapezium is because the joint between the trapezium and metacarpal 1 of the thumb has the greatest range of motion of all of the metacarpal joints, and this particular joint is going to allow for the opposable motion that we get, that grasping motion we get with our thumb is due to that joint between the trapezium and metacarpal 1 of the thumb. So that's the only carpal I will point out. But that's it for the hand.